we do have one online that'll get us going here. It's from Dr. Donna Lero. Dr. Lero, can you please comment on the longitudinal or lifelong effects of caregiving, particularly for women, men, early in their careers, for example, age 25 to 30 years of age, that are starting to care for parents, grandparents? In other words, do we know how caregiving around this age or starting at this age has a lifelong impact on quality of life, health outcomes, career development, etc.? And how does gender factor in here?
It's a great question. We actually don't have much longitudinal research on caregiving and its effects. In fact, one of the important things that we're becoming aware of is that people may have a number of different caregiving episodes across their life. We call this a caregiving trajectory. And some people start when they're much younger. Some people have an episode of caregiving, then a period when they're not, and then a second episode, perhaps with a different person. So it's a complicated situation to try to track. And ironically, the person who submitted the question asked about people in their 20s and 30s at an early stage of their career. I've become aware recently of some research on what is called young carers, young caregivers, and that's defined as under 25, so it's below the age that the person asked about. But there's some very interesting research in British Columbia on high school students and young people who are providing care, often to a parent with a significant physical or mental health problem, sometimes to a grandparent. And the concern with people in that early age is the impacts of caregiving on school and school completion, school performance, but also on their opportunity to socialize with peers, and certainly their opportunity to continue their education and to get launched in the job market. So there are long-term potential economic consequences of people who provide significant care earlier in their lives. And our conceptualization of the economic consequences of care is that we need to pay attention not only to the immediate time, but longer term, because if you think about a period in which you may be forfeiting a job to be out of the workforce completely, as many mothers with children with disabilities have done, the time that you're out of the workforce is time when you're not keeping up skills. It may be harder for you to get back into the workforce. There's a lack of earnings, but there's also a lack of savings and pension contributions. And in some of the conferences I've been to, there's the question of, is caregiving something that is going to result in poverty for seniors, particularly among women? So there are potentially long-term economic consequences, and I wish I could answer the question better, but we just don't have that longitudinal data.
Great, thank you. We've got another question from our online audience, and it goes like this. Given the fact that an increasing number of culturally diverse immigrants enter Canada every year, I'm wondering, what are the health consequences for immigrant family caregivers? For example, are immigrant family caregivers more likely than non-immigrants to report a health consequence? And I'm guessing that that's directed to you, Dr. Lero.
Again, this is an area where we really need more research. The jobs that people are occupying, especially when they are newcomers and their credentials are not yet recognized, is a factor. It's believed that we have many more immigrant women who are doing care work, both in homes and in long-term care facilities. So they're much more involved. In terms of health consequences, I haven't seen anything directly, but I did see a research report quite recently from California that looked at who is most at risk for employment consequences as a result of caregiving. And it suggested that there were three variables that were important. Women more than men, those who had less education, and those who were first-generation immigrants were more likely to provide more care, but they were also more likely to experience more significant consequences of that care. And in the case of those with less education and those who were recent immigrants, again, they were more likely to be covered under employer benefits, and actually were less likely to qualify in the U.S. for family and medical leave, which is based on different criteria than we have here in Canada. So if you were in a small business situation with fewer than 50 employees, in the States, your employer is not required to provide the unpaid leave for maternity or caregiving or sick leave. So that group was much more affected by it.
I can add a little bit from the perspective of being a new worker. There's a lot of research and studies on new workers, which we tend to think of as young workers, but it's actually anyone who's new. It can be an immigrant. It can be if I switch and suddenly go into mining, I'm the new worker because it's all new. And there is that. They're looking at whether it's they don't know their rights, they don't know they're allowed to speak up and ask questions about their health and safety, or they're too afraid to because they feel they would lose their job security if they did so. So there's a lot of factors that play into what people may or may not speak up for their rights as well.
Mm-hmm.
I just might be able to add a few tidbits to that question as well, with respect to consequences for immigrant family caregivers. And it really, in many ways, confirms the research that you just alluded to, Donna, that came out of California. Because we know that the more vulnerable the caregiver is within the workforce, the more likely they will have to leave the workforce because of their caregiving duties. And the policy interest and the policy context around that particular group of often female workers seems to be becoming quite acute as of late, because there's an interest in recognizing how we can keep these caregivers employed, how we can keep them engaged in the labor market, in order to continue keeping our economic engine rolling and our economic engine booming. So there seems to be a whole lot of interest in the whole idea of keeping these caregivers employed, and certainly not just the vulnerable, but also the others who are working in mid-career and often professional occupations. We know that caregivers generally range in age, but the majority of them are aged 45 to 65. We know that the majority are female. And we also know that a great number of them live in the suburbs, believe it or not. So that has an impact on, again, the sorts of workforces that are going to be impacted as a result of the caregiving role. We have another question from the online audience. Can the panel comment on the effect of family caregivers' beliefs and/or experiences of reciprocity, or feeling of giving back something to the family, specifically experiences of reciprocity on their health? Does it vary by gender?
From a personal or a research perspective?
Well, we can go with both, if you're willing to reveal.
I don't know the answer to the research one.
Okay, well, give us your personal if you're willing to share.
About how caring for my family affects my health? I think, well, certainly I feel like when I get through a day without yelling at my kids or they have a good time, it makes me feel much better about myself, whereas when my wife does that, it just seems like standard fare. So I think certainly there's a lot more pride. So often my wife and I, one of us will go away and the other one has to take care of the kids. I certainly get a lot more kudos when I manage to do it than when my wife manages to do it. People sort of almost expect me to fail. And I think that is a gendered expectation, but that's just been my personal experience. So for me, it actually enhances my health.
Thank you.
There's a lot of research on the positive benefits of providing care. People do feel closer to the person they're providing care for. They see it as gratifying. I guess for me, the question is how much of this is real and how much of this is rhetoric, to be quite honest. Because I think that the context in which you provide care is a very big factor. And if you're providing care alone and unsupported, even if you truly believe that this is what you're meant to do and what you should do, that's going to have different impacts than somebody who feels supported as a caregiver by other family members and by their community. So I think I think the reciprocity can be there and it can help sustain you, but it's not sufficient in many cases when you're looking at complex caregiving situations, when you're dealing with situations where a person may have dementia or may have other behavioral issues, and it's extremely challenging. So I think, yes, the reciprocity is there. I certainly feel it when I'm providing care for my 92-year-old mom. I get a lot of benefit out of doing it, but I also have a lot of support.
And I can certainly add to that conversation with respect to the role of the caregiver and the relationship that the caregiver has to the patient. So we know, for example, with spousal caregiving, because of the often expected role that the spouse has in providing care, the identity around that relationship often defines the degree to which the investment takes place, and consequently may also have some impact on the reciprocity experienced. There's less of a positive relationship with respect to sibling caregivers and child caregivers. So certainly the relationship between the caregiver and the care recipient is implicated in how this reciprocity is experienced, and certainly how it's impacted by gender. And I think Donna's point about dementia is a really, really critical one, because the patients with dementia are often the most challenging with respect to sustaining the caregiver relationship. So reciprocity is a really difficult one to define and think about within that caregiving relationship, because of the challenges that the care recipient receives. But I think it's a really fascinating question. I'm also wondering if there's also potentially an age or a cohort variation here. Because when we think about older generations, for example, my mother's generation, she's in her early 70s now, her role in life is to care for her spouse. It used to be to care for us, but now it's to care for her spouse. So the children have gone by the wayside, and now her partner is her primary meaning and her primary role. That certainly would be very different for myself as a middle-aged person, and I expect it would be very different for my 14-year-old daughter, who would likely see things very differently than I would. So I think there's a cohort variation in that whole relationship piece too, around identity, investment, and reciprocity. And certainly gender is very much implicated in that as well.